after having severe migraine pain that would not stop with medication for treatment, only to be put.
So, with few exceptions, there is nothing that absolutely pisses me off more than people in the healthcare system who use psychiatric holds inappropriately. So, for those of you who don't know, most states have a statute that allows a person to be held typically 72, but I've seen sometimes as little as 48 business hours when they have been assessed to be an imminent, like an immediate danger to themselves, to someone else. Or some states have part of that statute also say for grave disability, but not all states have that. And depending on where you are, this may be called different things. So in Georgia, where I am, it's called 1013, which is kind of after the statute we have here. In Indiana, where I trained, it was called an emergency detention. I've seen it called a PEC, psychiatric emergency commitment. Florida is called Baker Act. Anyway, depending on where you are, it may be called something different, but essentially that's what it is. It gives typically a healthcare provider, and sometimes very specific mental health providers like master's level counselors, the ability to have someone held for an evaluation of their safety when, like I said, they've either made an imminent threat to hurt themselves, they say they're going to hurt someone else, or have a lot of risk factors for that, or are gravely disabled in some cases. And when we, and I'm going to say we just meaning any healthcare provider who's able to do this, because in most states, it's not always limited to a psychiatrist or another mental health provider. It is typically more broad, which makes sense, right? Because a lot of areas are underserved for mental health, so there may not even be a psychiatrist or a therapist available to do an immediate assessment. So again, in most places, it might be just like any physician or, any nurse practitioner, for example. But when we use this inappropriately, not only do we erode trust when it's like an individual patient we're seeing, we erode trust in the healthcare system, in the mental health system, period. Okay, because it is a violation. We have certain civil rights, right? And so if we're going to violate that and put someone in the most restrictive setting, meaning you're in a locked place and you cannot leave, that should be used very sparingly. I'm talking about on a rare occasion. And over my clinical time practicing, I literally use this so infrequently, because of that. Because on the mental health side, we should receive training in how to do violence risk assessments, suicide risk assessments, to make that determination. And of course, everything isn't black and white. There are times where you have to make using your best clinical judgment, hopefully if you have a relationship with that person, using the best information that you have, but to send people to to put people on emergency holds just because they, talk about self-harm without really doing assessments. And again, nobody expects anyone to be able to tell the future. All we can do is do a risk assessments, make clinical decisions based on the data and information we have. So the data and information we have about this case is that a person asked her medical team to wear a mask and essentially got placed on a psychiatric hold and deemed psychotic. This is just wildly inappropriate. Unless we're missing some really big part of this scenario, this is just ridiculous. If I got called to consult on this, I would be so upset. I would be so upset with that team if I had got called to consult on this patient for these reasons. I would probably blow my top at that team. What are y'all doing? But putting this person in a psyche R for this. And the other thing, and I don't know, again, the details of this case, this scenario, but people do exist with psychiatric symptoms all the time. There are people who hear voices, who have chronic delusional thinking, who are hypomanic. There are people who just live like that. And sometimes even with treatment, symptoms are just resistant to what you're taking. There are people who take their medication, they still have some psychotic symptoms, and we are not out here putting these people on involuntary psychiatric holds just for having symptoms. So I guess my point is, even if the person was psychotic and that was their reason for asking people to wear a mask, how does that put anybody at an imminent danger? How is that putting her in danger because she asked someone to wear a mask? I just can't even envision a scenario where this would be appropriate. And for anyone who in healthcare who is watching this and has the ability to put people on these holds, just know that you're not only violating that person's rights when you do it inappropriately. I've seen a few cases where people who do have the means and have resources, have had lawsuits because they were held inappropriately. Hospital systems can be held legally liable when this is done the wrong way. But also, we shouldn't do it just because we don't agree with whatever the patient's choices or decisions are. People make choices all the time against medical advice that, maybe we wouldn't make. It doesn't mean that they need to be labeled with a psychiatric diagnosis and then put on a hold involuntarily. Y'all, this is so harmful. It's so inappropriate. I just can't even come up with more words than that. It's just one of the worst things that you could do to someone.